Welcome to Wednesday's edition of COVID-19. With the weekend factor out of the way, Korea's daily tally has hit above 700 today. And amid this concerning trend, we revisit the task of public vaccinations against the backdrop of variants here and elsewhere around the world. Let's start now with the pandemic updates. So here on the domestic front, we are looking at almost 200 more infections compared to Tuesday.
Right, Sunny. Well, 191 more to be exact, as 707 cases were reported as of 12 a.m. this Wednesday. And with that, the number of domestically transmitted infections has risen to the high 600s. This number was in the high 400s just a day ago. And that has raised Korea's total to 137,682 with 1,940 COVID-19 related fatalities. And as you can see on our graph now, we are seeing quite a jump here from the 500s to the 700s as throughout the past week, the numbers were hovering between the 500s and 600s. But if we take a look at Wednesday's tally here for the past weeks, we did see 700s and also high 600s on Wednesdays because usually we have a higher figure by the middle of the work week. And this Wednesday, we are seeing a rise in the capital, Seoul, with 262 new infections. And with that, the capital has surpassed 43,000 cases in total. And also Daejeon here with 17 new cases has surpassed 2,000 infections in total. And we are also seeing here concerns over in the southeastern part of the country. And let's get an update on the vaccination front. We've had some 77,000 people who received their first shot yesterday and over 91,000 who got their second dose. And with that, around 7.7% of the nation's population has now been vaccinated.
Right, so and staying on that vaccination front, I understand the government has unveiled its list of incentives.
It has, announced by the Prime Minister earlier in the morning and then later thoroughly explained by Health Minister Kwon Dok-chol. The government has announced its vaccine incentives that are to be implemented largely in 3 steps. Take a listen.
Prevention measures will be partially lifted early next month, and further easing is expected in early July, when vaccinations for the elderly are complete, and also in early October, when 70% of the nation's population has been vaccinated.
So what does that entail? First off, vaccinated people will be exempt from restrictions on the number of people that can gather for private gatherings, which currently is set at under 5 and 8 in the case of gatherings of immediate family members. Senior welfare facilities will reopen in June, and personal visits to nursing hospitals will be permitted. In July, that's when around a quarter of the nation's population should have been inoculated. People who received at least 1 dose will be allowed to take off their masks outdoors, with the exception of crowded outdoor spaces. And along with that, the revision of the social distancing system for the entire public is slated for the month of July too. Now, that scheme is expected to go under another revision once 70% of the population has been vaccinated, so around fall. Discussions will also be made on a possible easing of mask-wearing rules in indoor facilities.
Right. Meanwhile, so on the international front, the debate on the origin of the coronavirus has gotten quite fierce in recent days.
Right, Sunny. Top U.S. infectious disease expert Anthony Fauci called on swift follow-up investigations on Tuesday on determining the origin of COVID-19, amid questions having resurfaced on whether a lab leak could have led to the pandemic, and that following a recent report that cited U.S. intelligence. Now, China has dismissed that suspicion. Now, whether lab leak or not, it's been 1 year and a half since the COVID-19 outbreak in Wuhan, and it has led to 168.5 million infections and also almost 3.5 million fatalities. Meanwhile, the number of recoveries so far has surpassed 150 million. And the U.S., which is keen on finding that result of the outbreak here has the highest number of total cases at 33.9 million, followed by India and Brazil. India's daily caseload has surpassed 200,000 again, and also Brazil is seeing some 74,000 new infections in the past 24 hours. And those are the updates I have for now. Back to you, Sunny.
Thank you for that. Right, now late last week, the leaders of South Korea and the US met for talks over in Washington, D.C. and reaffirmed their commitment to global well-being. For details on what was shared, I have Ji Abby Lee here in the studio with me. Good to see you again.
Hi, Sunny. President Moon Jae-in visited the American capital last Wednesday through Saturday, making it his first official state visit since the pandemic broke. It was also President Biden's second summit with a foreign leader since taking office. In today's segment, we'll talk about the vaccine collaboration efforts. And to do that, let's start off with Korea's Foreign Minister, Chung Eui-yong.
For our visit to the U.S., we have chosen the joint communique and summary documents of our partnership as the summit statement, a milestone that revisits the 70-year-long South Korea-U.S. alliance and serves as a guidepost for its future.
That was Minister Chung speaking at a joint press conference along with the Ministers of Trade and Health. On a broader note, Presidents Moon and Biden reaffirmed their shared goal of maintaining peace on the Korean Peninsula and tackling other global challenges like climate change. During the summit, President Biden said the U.S. would provide vaccines for more than 500,000 South Korean service members who cross-train with American soldiers on a regular basis. The decision was well received by Seoul and local media alike.
This decision reflects their gratitude for the emergency medical supplies we provided them in the early days of the pandemic, and also symbolizes the unique spirit of the South Korea-U.S. alliance.
Right, now I understand the two countries are looking beyond bilateral needs to those of the globe with regard to vaccine collaboration.
That is correct. So we're already seeing some tangible results from the partnership, as you can see from that vaccine shipment that's coming from the U.S. Not only that, the countries will revise the 2003 MOU on Korea-U.S. healthcare cooperation and will also launch a joint working committee on their global vaccine partnership. The group will consist of scientists, industry experts, and government officials from both sides. They will not only work toward ending the pandemic as soon as possible, but also prepare for the next global healthcare threat. Let's hear from the health minister at Tuesday's briefing on the importance of the partnership.
The creation of the Korea-U.S. vaccine partnership shows that the two countries are not only allies in the realm of security, but also companions in the struggle against the global health crisis.
The Korean government views the endeavor as an ideal match, combining America's technological prowess in the biotech sector with Korea's pharmaceutical production capacity that's ranked second in the world, only behind the U.S.
Right. Now, I believe the private sector will also be deeply involved in this vaccine partnership.
That's correct. So under the Global Vaccine Partnership, the two countries have signed 4 agreements, either in the form of business agreements or MOUs. Samsung Biologics signed a business contract with Moderna to produce mRNA vaccines. In the Q&A session of the briefing, Health Minister Kwon emphasized these will be the first mRNA vaccines ever produced in Korea. He was challenged the agreement is not a full technology transfer, but a mere final step in the vaccine production. This is what Kwon had to say in response.
The final manufacturing process of vaccines not only involves packaging and sealing, but also cutting-edge technology in sanitation and quality control. This requires technology transfer and cooperation from the original vaccine developer to meet the highest of quality standards.
Seoul also signed an MOU with Moderna to facilitate the company's investment in the country. Minister Kwon concluded the summit will also set the foundation for Korea to become the global vaccine production hub. That's all for me today.
All right, Abby, as always, thank you very much for the coverage.
My pleasure.
It's time now for our special week-long series on the 5 arenas for global action in light of climate change. In this third installment, we shed light on the impact of climate conditions on food security.
The COVID-19 pandemic has had a devastating impact on food security, pushing 130 million more people across the globe into hunger last year, casting a shadow over the UN's goal of completely eradicating world hunger by the year 2030. Climate change has triggered droughts and floods as well as locust outbreaks that have destroyed millions of acres of farmlands worldwide. Farming activity itself also generates a significant amount of carbon emissions and has been a source of major environmental concern.
물이라든가 또 에너지 사용량, 또 비료, 농약 이런 사용량을 가능한 적게 하면서 동일한 생산량 내지는 더 많은 수확량을 내는 기술을 개발해야 되거든요. 특히나 이제 개도국들의 경우에는 그런 농업 관련된 생산 기술이나 시설이나 이런 것들이 또 좀 기술 수준이 좀 낮기 때문에 선진국들이 개도국들을 그런 분야에서 많은 지원을 ODA 같은 형태로 많은 지원을 해야 할 필요가 있습니다.
During this workshop held in Seoul in early May, officials from Korea and Ethiopia gathered to discuss a joint project as part of a wider P4G framework.
에티오피아에서도 과거에는 농업도 많이 하고 커피 산업도 많이 했었던 남부 지역이 점점 건조해지면서 예전처럼 커피 농업을 할 수 없게 되는 그런 문제점들이 생겨서 그거를 민간과 이제 정부 분야가 서로 파트너십을 만들어서 그 해결 방법을 찾아보자는 게 저희 에티오피아 사업의 가장 근본적인 컨셉입니다.
The project is a multilateral and multi-stakeholder effort involving the Korea Forest Service, the Global Green Growth Institute, Ethiopia's Environment and Coffee Forest Forum, and also Korean firms representing both the conglomerate and startup sectors.
P4G 사업을 통해서 나무와 그리고 가공센터를 지어줌으로 인해서 생산량의 증대와 품질의 증대와 같은 이런 효과를 거둬서 궁극적으로 이들이 소득을 증대할 수 있고 실질적으로 저희가 지원했던 농가들은 최소 소득이 2배 이상 증대되었고 생산량도 최소 2배가 증대되었습니다.
The project also aims to promote peace and stability in the region, addressing the growing tribal conflicts in Ethiopia's coffee-growing southern regions, which has worsened as coffee farmers fight for their survival amid the fallout of climate change. The initiative not only seeks to protect Ethiopia's coffee industry, but also to promote mutual trust and collaboration between the different tribal groups who all depend on coffee to maintain their livelihoods.
I'm very happy to be part of this project because it is also implemented in areas where there is peace, there is conflict between different communities. So if you keep your environment healthy, functional, and continue producing what you need for your basic survival, the conflict will be minimal.
Resilient and sustainable agriculture and food systems, helping local farmers to withstand the effects of climate change, will be the headline discussion on the theme of agriculture at the P4G Summit.
농업 생산은 늘리면서, 그러니까 식량 안보를 지키면서 농업 분야에서 탄소 중립도 하는 이것을 양립시키는 것이 굉장히 중요한 두 가지의 과제고 그 두 가지 과제를 이번 세션에서 이제 논의를 하게 될 것입니다.
심지어 11월 이전부터 지역사회의 방역 효과가 뚜렷하게 나타나게 할 수 있고 동시에 코로나19 유행도 통제할 수 있습니다.
No doubt in my mind that the dramatic drop in active corona patients and the spreading of the virus is strongly associated with the vaccination campaign.
But if the variant is significantly more transmissible, we're likely to face some hard choices. And we're going to be learning a lot more in the coming days and weeks about that.
It's been precisely 3 months since the start of COVID-19 vaccinations here in Korea. So far, over 7% of the population has received the first dose amid plans to reach herd immunity in September. Now, today we explore the variables that look to challenge those very plans. Here in the studio, I have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Thank you for having me.
And I have Professor Cyril Cohen at Arirang University, who is also a member of the Israeli Health Ministry's Advisory Committee on Coronavirus Vaccines. It's a pleasure to see you again, Professor Cohen.
Thank you. Likewise, Sunny. Thank you.
Also virtually, I have David Cox over in the UK. David, it's been a while.
It's been great to be back on the show again, Sunny. Thank you for having me.
Right. Then, Professor Kim, we'll start here in the studio. Let's begin with a brief assessment of the inoculation campaign here in Korea and efforts to procure vaccines.
The speed of the vaccination is an issue. The program started similar to the average Western countries in Korea, which means it was far slower than Israel or UK. But since the end of April, we have a little bit slowed down of the vaccination rate. I think it's because of the supply issue. But I would like to compare with Mongolia right now. They started similar date, and now they have vaccinated more than 50% of their population. So I wish that we could reach that level very fast, and I'm sure that we might have far less cases, and already we might have eased some quarantine measures also. And so we have to prevent any shortage of supply and solve the mistrust among some groups. Yeah.
Right. David, the UK, meanwhile, was the first to launch COVID-19 vaccinations last December with Pfizer vaccines. What has been the impact of public inoculations on efforts to contain the virus over in the UK, David?
I think it's been pretty significant. So right now, 23 million people across the UK have been fully vaccinated, around 34% of the population, and around 60% have had at least one dose. And we're seeing a big impact of that. So even with the new variants at the moment, COVID-19 cases have fallen dramatically since mid-February, and there's no sign of that changing, even with restrictions currently ending in the UK and people being able to socialise indoors again. So currently there's around 2,000 cases a day compared to the peak of 60,000. So that's a big, big change. And we're now back to the levels of last summer, which is really encouraging.
Right, that is good to know. David, what has been the response to the Oxford Astrozenica vaccine in the UK?
So there are lots of cases which have of blood clots in particular, which have concerned a lot of people. But thankfully, these are still relatively rare. So the rates are around 1 in 80,000 of people getting clots when they have their first dose. And there have been some new reports of clotting for people even after the second dose of the vaccine, which has caused a bit of concern, but that's even rarer, luckily. So it's about 1 in 600,000. But because these blood clots are being found to be more frequent in younger people, at the moment the vaccine has been restricted across the UK for all under 40s. So right now the only people who are still getting the AstraZeneca vaccine are the ones who've already had one dose of it.
I see. Meanwhile, Professor Cohen, Israel looks to be the first country to return to normality amid its high vaccination rate. Now, please tell us a bit about life there right now.
I would say that life is back to normal, really. Next week, we are about, exactly in a week, we are about to lift most of the restrictions. We have around 60% of the population vaccinated, at least with one dose, around 55 with 2 doses. If you add to that the people that were sick and recovered from the disease, we really reached a state of herd immunity. And therefore, I would say, we have no mask outside. We are only maintaining right now mask inside, but everything is getting back to normal. Restaurants, movie theaters, gyms, etc., gatherings. So it is a good feeling, I have to tell you.
Right, and hopefully that will be the case for the rest of the world in the near future. Meanwhile, Professor Kim, back here in Korea, authorities are looking to offer incentives to those fully vaccinated, and among them include the exemption from face masks for those who've even received at least one dose of the vaccine, starting, I believe, in July. What are your thoughts?
It's good news. Now we have about 500 cases per day, and at the end of November last year, we passed 500, and a few weeks later, it reached almost 1,000. And The fatality cases also increased to 20 cases per day. But now the mortality remains in single digit right now, and I'm sure that it's because of the effect of the vaccination program. And what are the motives to get vaccinated? Primarily, I think we want to protect ourselves and protect my family, my neighbors, and colleagues. And secondarily, I think we want to return to normal life, normal economy, and education, etc. But we must understand that there are groups of people who are reluctant and hesitant to get vaccination. So we must accumulate a scientific and very subjective data to explain, continue to explain, because everything is still ongoing. So I would like to learn from the Israel model and UK model, and we must have our own Korean model. So as you mentioned, how we're going to get the gatherings and how we're going to travel and how we're going to do the quarantine during business. So we must put our goal of the incentives to motivate people. And even though everybody got vaccinated, I think we still have to wear masks indoors. And when we drink or eating together, we should keep quarantine measures.
All right. Professor Cohen, staying with incentives, how effective was the Green Pass initiative in Israel in boosting public inoculation?
I think that the green passport that we are actually canceling next week was effective more for the young people than for the, I would say, midlife people or older people. I think for the older people, the main factor was a grandmother factor, that you want to hug your grandkids. That was definitely the most important thing for them. I think for the young people, getting a possibility to get back, inside restaurants or, other activities with the green passport has been effective. But I think that at the end of the day, the people in Israel are very, I would say, pragmatic. And from the moment, they saw that the vaccination is working, the number are going down. Today, we have only 20 cases, daily cases in Israel. In total, we have 400 cases in Israel. I think that people understood that the vaccination is working and that you should get protected.
Professor Cohen, was there no vaccine hesitancy in Israel from the start of the campaign, vaccination campaign, that is?
So there was some vaccine hesitancy, of course. What we know from polls that were done is that around 40% of the people at the beginning, I'm talking in December, were willing to get vaccinated. 40% were hesitating, and 20% said, I won't get the vaccine. At the end of the day, what we have seen now is that around 85% to 90% of the eligible population got the vaccine, and we have a small number of 10% that said that they will not get the vaccine. So I think it is a process, it is a gradual process, and the more people are getting vaccinated, the more people are willing, around you to get also vaccinated.
Right. Professor Kim, a major obstacle to containment efforts appears to be the presence of variants, including those from the UK and India. What risks are these mutations posing for Korean authorities at the moment?
A portion of the variant strains are increasing in Korea. We used to have 10, 20, 30, but now we have hundreds. They might reach thousands soon. And now most of them are Kent variant, which came from UK. And there was a cluster outbreak in Ulsan city. And recently we have another one in Jeju province. And about 50 cases are variants, and 29 from UK variant, and one we have an Indian variant. So now we have Indian right now. And if the Indian variants keep on spreading to Southern Asia, I think it might also dominate in Korea also, which is a situation not good. So we must continue to monitor every imported cases in a single bed, individually isolated, at least for 2 weeks. We must block their spread inside our country.
Right. David, The UK, I believe, is also witnessing the spread of the Indian variant. What has been disclosed by authorities there with regard to the efficacy of our current vaccines on these variants?
Yeah, so Public Health England, they've just finished a big study all about this. So the results were a little bit mixed. The Pfizer vaccine was really effective, 88% effective. But for people who had the Astrozeneca vaccine, that dropped to about 60%. But the really key thing the study actually did show was the importance of having both vaccine doses. So both the vaccines were only 33% effective against the variant after one dose. But the government is quite pleased with the results, I think. So at the moment, like the official statement they're putting out is about 1 in 3 people in the UK they feel have significant protection against this variant. And they're still, because of that, planning to completely go ahead and ease COVID restrictions altogether on June the 21st. So I think we're just monitoring the situation at the moment as it unfolds.
I see. Professor Cohen, I understand among those, the very few that is, infected with the Indian variant over in Israel are people who were fully vaccinated. How are authorities in Israel there responding to this reality?
So the good thing about, as David said, the good thing is that the Pfizer vaccine, which is the dominant vaccine in Israel, almost 100% of the people in Israel got the Pfizer vaccine. So the vaccine seems to be effective. So we have around tens of cases of the Indian variant. Some of them, or most of them, were imported in Israel. That's why what we're doing right now is really controlling the only port of entry in Israel, which is the airport, the Ben Gurion airport in Israel near Tel Aviv. And we are sequencing every positive case. We can do that because we have only 20 to 30 cases, daily cases. So we are sequencing, tracking every variant. I would say the Kent variant is still the dominant variant with 80 to 90% of the daily infections, but still we are very cautious, though we are relying at the same time also on the effect of the vaccination.
Right. David, Britain has launched a study to test the safety and effectiveness of booster shots. Could you tell us a bit more about this study?
Yes, so this is called the Cove Boost trial, and it's looking at the effect of giving an additional third dose of one of 7 different vaccines to 3,000 people in the UK, on top of either the Pfizer or the AstraZeneca vaccine. So the government's quite interested because it wants to see whether a third dose raises antibody levels enough to protect against all of the possible new variant strains of COVID. It will take probably about at least a month or 2, I think, before we know the results from that. But it'll be quite interesting because if it does raise antibody levels a lot, that would be a huge, huge boost in terms of easing restrictions and not being so worried about the threats of new variants. But if it doesn't work, then plan B is basically to develop modified versions of the vaccines which will work against new variants. So I think we're just going to have to see again in the next couple of months, and it'd be quite interesting to see the results of that study.
Right, and we'll probably have you back with us on the show to tell us more about that, of course. Now, Professor Kim, there are concerns over calls for booster shots, though. Given the shortage in vaccine supplies, what are your thoughts on this?
If we think globally, I think the booster shot might have a lower priority right now, and more urgent need in some heavily affected countries like India or Bangladesh or some South American countries might have a more priority. Locally, for Korea, after a certain degree of herd immunity, then we can think about booster shots for the high-risk group first. Still, we have to know, is there any safety issues because of the booster shots? And also, we might have to think about the pediatric age group, whether we're going to continue with them or not. So it's a little bit fast story for Korea right now.
Right. And I extend the same question to you, Professor Cohen. What are your thoughts on the launch of booster shots, given the shortages we face at the moment of vaccines?
So right now in Israel, we decided, based on the results we have and also the results from the clinical trials, that we will not need, hopefully, a booster shot until the end of 2021. And therefore, we have some margins of action, but we are always at the mercy of a new variant. So in that case, we already signed contracts to get more doses in the upcoming months. We'll see. We'll be very, I would say, we'll try to adapt to the situation in real time, as we usually do.
Right, and David, we were speaking right before the program. You talked about getting your vaccine tomorrow. What is the vaccination campaign? How is the vaccination campaign that is moving in the UK for those your age? That would be.
It's moving really quickly. So at the moment, it's everyone 32 and under is eligible to get the vaccine. So I think definitely, probably by November, or maybe even sooner, everyone in the UK will probably be completely vaccinated, which is really exciting.
Right. All right then, Professor Cohen in Israel and David in the UK, thank you both very much for making the time to join us live at this hour.
Thanks for having me, Shane.
Right then, up next, we turn to the United Arab Emirates, where authorities have been actively vaccinating their people to ensure protection against COVID-19. For more on this, I have Ali Al-Shuk live on the line. Welcome to the program, Ali.
Yes, and I can hear you. Thanks for hosting me.
Right, Ali. Now, I hear over 70% of those eligible for COVID-19 vaccinations in the UAE received their doses. Tell us a bit more about this very remarkable achievement.
That's true. I mean, it was really a remarkable achievement by the UAE government. Actually, it's 78% of eligible population in the UAE actually vaccinated. Those stats were announced yesterday by the UAE government. So, I mean, the vaccination campaign, it was a big campaign in the UAE since the beginning. I mean, since the beginning, there were clinical trials from last year. And then they started the vaccination program all across the country. I mean, vaccination centers were open, drive-through centers, because, you know, an increasing access of testing is really an important factor to curb COVID-19. And UAE has been extremely energetic in the fight to curb COVID-19 by setting drive-through testing center across the country. I mean, you drive your car, you get the test centers. And then after that, they use this for vaccination programs. In the UAE, we have a different kind of vaccination in the UAE. And they were encouraging the community to be vaccinated to reach the herd immunity. And they are really doing well in the UAE with the vaccination program.
Ali, I understand those eligible for vaccinations in the UAE are those aged 16 and above. Which vaccines were administered on those aged 16, 17 and 18?
16, you said?
Yes, 16 years old.
Well, for now, I mean, recently they announced that Pfizer can be used for the ages 12 years old and above. Because before, the vaccination used to be for people from the age of 16 and above. We used Sinopharm, Pfizer, Sputnik. But now they announced that people on the age of 12 and above, they can be vaccinated.
Ali, were people there allowed to perhaps choose the vaccine that they would prefer to have administered?
Yes, you can choose any vaccine, actually. They use different apps. You can choose any vaccine. It's up to you. I mean, people are searching for different kind of vaccines, and then they decide. So, I mean, at the beginning, it was only Sinopharm at the beginning. I mean, what I'm talking about from last year. But now, I mean, it's more vaccines allowed in the country, and it's up to you to choose which vaccine.
I see. Keeping in mind what Ali has just said, Professor Kim, what are your thoughts on allowing members of the public to have a selection or option to choose vaccines to boost perhaps the inoculation campaign?
Wow, that's a very difficult question.
It is. And if you had more supplies, I suppose it would be possible, but still.
Well, people might choose according to their thoughts, and for Korea, I mean, we most of our population had Astrozeneca, and most of the side effects came from Astrozeneca. So we know much about Astra, and actually we don't have enough experience with other companies. So
that's a very good point.
Yeah, but if we think of the variants, I think RNA virus is quite effective right now. But if we think about the mortality, it's almost the same. So any kind of vaccine will work for that situation. And as Ali is in the program right now, we have many questions for him right now, because South Korea and UAE is quite different. Weather is different, and the kinds of vaccine used is different, and the population composition is different. I mean, Korea is like a very homogeneous country but UAE might have a lot of workers coming from foreign countries.
Right, 90% of the population
Yeah.
there are foreign workers, right, Ali?
Yes, yes. We have around 200 nationalities living in the UAE.
And how were authorities able to get the foreign workers to go and get their vaccines?
Well, it was at the beginning there were concerns about taking the vaccine, just like everywhere in the world. But then, I mean, educational campaigns, awareness campaigns. The government launched a different kind of awareness campaigns. They show the best for the vaccines and why we should take it. And sooner, I mean, after in the beginning, people were hesitating. But when days start passing, people posting on social media that he took the vaccine or so other, people were encouraged to take the vaccine. And for the workers, I mean, we have also a lot of workers here in the UAE. I mean, the educational campaigns in their languages, I mean, here they use different languages. In their language, the educational campaigns, it's reached them. So they became more aware about the importance of vaccine. Any kind of vaccine, it will work.
Right. Ali, now despite the high vaccination numbers in the UAE, authorities there are still tackling well over 1,000 infections on a daily basis, I understand. What appears to be keeping the tally relatively high?
Well, yesterday, for example, the number was 1,672 new COVID-19. So from the beginning, I think, of the pandemic, the UAE reported around 559,000 cases. The thing is, the recovery rate is really high in the UAE. I mean, it's 539,000 people were recovered from the coronavirus. UAE, from the beginning, they start opening the borders and welcome people here. I mean, they have a strong belief and confidence on their system and what they achieved until now. So, I mean, recently, yesterday, they allowed all events, exhibition activities like sports, culture, social activities, concerts to be open in the UAE, but for vaccinated people. So the vaccinated people, they kind of will have a privilege in going back to normal. And life is really back to normal in the UAE months ago. I mean, you can see shopping centers, a lot of people visiting it. I mean, the thing is, people still following the precautionary measures that have been announced since the pandemic, when it started last year, about wearing masks and keeping social distancing. They are strict with that. And that's what really helped to establish just like a new condition of people walking safely in the streets despite COVID-19.
That is very encouraging to know. Keeping in mind what Ali has just said, Professor Kim, what do you suppose can Korea take away, so to speak, from the situation in the UAE?
Well, I think there are a lot of communications coming and going from India to UAE, as far as I understand. I don't know whether Ali has a data about that cases of Indian variants or not, but I think there's a high possibility about that, and because the new variants are usually more infectious, and that means it's very hard to contain. So still, we might have to keep a very strict quarantine measures until India is under control right now. And having a very subjective and accurate data after vaccination is very important. And I wonder whether Korea is doing in a proper way or not, because since I had a first shot and tomorrow I'm going to have the second one, but I think I have to be monitored more closely for any side effects or something, and like to check for antibody or something else. I wish that we keep on very strict monitoring even after the vaccination. And even after the second shot, everybody knows that we still have to keep on social distancing, mask wearing, and hand washing, everything. And we saw many countries, since we had an outbreak in India, then it moved to Nepal, then to Bangladesh, and to Cambodia. If it's march on like that, and now Taiwan used to be a very model case to quarantine against COVID-19, but right now it's only half size of Korea, but they have hundreds of cases, which is very bad right now. So we have to be very vigilant, and the health authorities should prepare for any possible breakthrough infections. So we have to study UAE, India, and other countries, and then prepare for the next.
All right, because it is a global challenge right now.
Correct.
Ali, the UAE also looks to be the first country to formally introduce booster shots, as authorities there have announced plans to offer a third shot to those who receive China's Sinopharm vaccine. Could you tell us more about this, please?
Yes, recently the UAE authority, they said that people who get the second dose of Sinopharm, after 6 months of the second dose, they can take a booster dose. It's now for the people who are over age of 60, I mean the elderly people, and that's actually it's a booster. I mean it will increase the immunization of people here in the UAE, and they told people it's okay to take the booster. It's up to you if you want to take the booster, but it's allowed now to get the booster for Sinopharm, just for Sinopharm.
I see. Ali, you mentioned earlier about the vaccination campaign having been extended to include those aged between 12 and 15 in the UAE with the Pfizer vaccine, of course. Now, what more can you tell us about this recent decision?
Well, from the beginning of the pandemic, I mean, the schools were also affected. I mean, the students were going for online studying. And this year, we have the schools is either you go online or you go to the site. So I think with this new order that to give vaccine for students, 12 years old and above, they want people also students to go back to their normal life. I mean, away from the online learning, it is really important to go back to schools. I mean, the kids, they need to play in the schools and they need to see each other. So with this order, it will enhance the situation of immunization of everybody here in the UAE. I mean, 78% of eligible people vaccinated. So they are looking for more categories.
I see. And Professor Kim, as a doctor yourself, what are your thoughts on the inclusion of minors in the public vaccination campaign?
You mean kids?
Yes, 12, 13, 14, 15.
Yeah. Safety is a primary issue, and vaccination above 12 years of age has a little dispute because I think it's relatively safe if there's no shortage of supply. But we have to approach very carefully for children not to disrupt the routine vaccination schedule. And most of the vaccination, the effect lasts for 10 to 15 years. And many articles insist that there are some non-specific immune booster after some vaccinations against COVID-19, such as MMR or BCG or something. So if your children is on routine vaccination schedule right now, I think it's not that urgent. I mean, they must be aged less than 12. And we have another issue about the dosage of the children. Should we use the half of the adult or how much? So that's another issue because usually children have a very strong immune response when they got vaccinated. So I think it's going to take some years to have a clear, definite indication for children for COVID-19 vaccination.
I see. All right, Professor Kim, as always, thank you very much for your insights, and get plenty of rest and drink plenty of water before your vaccination tomorrow.
Thank you.
And Ali, over in the UAE, thank you very much for taking my impromptu questions as well.
Thank you, and thank you for hosting me. It was my pleasure.
Right then, well, that brings us to the end of this edition of COVID-19. The battle against the pandemic continues in most parts of the world, so do seek to take care. Thank you for watching.